Hi everyone, happy Tuesday. Today in my chronic migraine life, I want to talk about finding a cure. I've talked about finding a cure before, but I recently been watching this show on TNT, TBS. It's called Chasing a Cure. And it's basically people all around the country who are trying to find answers and really diagnosis before they can find a cure of what's wrong with them. They're mostly young people in the prime of their life that wake up one day with horrific pain or immobility or violently ill and making millions of trips to the ER without avail, without answers, and they're ultimately afraid for their lives. You know, people that were marathon runners now can barely walk to the bathroom, or just really mind-boggling stuff. If you ever watched House, I used to like that show, and it's really about putting all these pieces together. A lot of the diseases are very rare, hard to diagnose, or they live in really rural areas and they can't have access to the, specialty medicine. There was a column in the New York Times magazine that I used to really like. I think it's still out there, by Dr. Lisa Sanders, and she was a diagnostician, and what people were writing in, and she would tell these people about all these cases that she had, and then see if you could guess the diagnosis, and then she would tell you what happened. And it was really interesting and stuff, and I always had a fascination for that. But while I watched the show, I really had to sit back and with myself and count my blessings. Not only because I'm in relatively good health, but because I know what's wrong with me. I've had a really long chronic illness, but it has a name. And so all those times when I had to cancel on plans or check out of my life, it had a name. There was a reason. Now, chronic migraines don't have a cure. There is really no migraine protocol drugs. The drugs that migraine patients take are typically for other diseases. Epilepsy, they're antidepressants, they're anti-inflammatories, which really can be used in any part of your body. There's no set drug. There's no, you have an infection, you need penicillin. There's no, you have diabetes, you need insulin. There's no, there's no cause and effect. Now, 8 years ago, when I finally found a headache specialist, that's the kind of neurologist migraine patients see, I knew I had migraines, but I really didn't know that there was a kind. Now, they can be episodic or chronic. Chronic means 15 or more days a month. Episodic is just periodic, really. But at that point, I didn't even know there were other kinds of headache disorders, and there are several. And the places you get pain and the things that you experience are different. But I didn't know that that was a specialty of medicine. I really didn't. And all it took was a physical exam, a thorough physical exam, and my doctor had a name for it in that first session. And while my relief didn't really come with that, I found out that there was a lot of things I could do about my migraines, a lot of trial and error, a lot of medications I could try. And that was both scary and some sort of relief. I knew there was a lot of things I could do to help myself, but what would work? And finding what dosage and what combination of drugs would work would take about 6 years. Ultimately, what works for me is Botox. I get 41 injections every 3 months throughout my forehead, the whole side of my head, back down, my shoulders, and my neck. And it's been a godsend. Now, while you're finding your cure, you also have to take the good with the bad. I didn't know that until recently. This is something I haven't talked about on a broad scale basis before, but I was taking for a large part of my life anywhere between 10 to 25 preventative medications a day. And at the time, I didn't really experience side effects. My body was really always very good with that. Some drugs make your heart race. I had to go for EKGs a lot and stuff like that, blood tests. But I was very blessed in that way. However, now that I'm off them, and I've only really been off them a few months. I think it was episode 4 of my video series. I was filling my pill case for the first time. And that was something that used to really stress me out and take a long time because there was a lot of things. If I was weaning off something or adding something, it was always a balancing act. But it was the first time I was filling my pill case in recent memory, and there was no migraine daily preventative medication in there. And it brought me to tears. The video is only a few minutes, but once I stopped filming, I cried my eyes out for an hour and a half. Happy tears, I guess, ultimately, but also sadness for the girl that had to sit there and put all that together and pay such close attention, and when you're not feeling well, having to do all that kind of stuff, and it still sort of blows my mind. So even though I feel like I have been doing so well for a long time, I haven't really been my newest normal all that long. It's only been really a few months. And so the other thing with dealing with the cure is that when you're in dire straits, you have to do whatever it takes to get better. And I've had to make my peace with that. I mean, at the time I didn't care. I didn't give a shit. I was dying is what it felt like. And I would do whatever they say. Some of those drugs might have made me worse, or maybe I was just so sick that I don't know, but there was a lot of cause and effect. Effects that I didn't know I would have to deal with later on because there was not a lot of research done in migraines, which is why they don't have their own drugs until very recently. So there's not a lot of money, a lot of time donated to those kinds of things. So while 36 million people across this country are suffering, often on unemployment, sometimes even from young children that they were, never even get relief. So while I'm grateful for where I am now in my life, I had to bargain with the devil to get there. I have a lot of cavities in my teeth, and prolonged medication tends to do that. I mean, no one outright says it, but you just put things together. Also, I've found out that I have cataracts and will need surgery probably within 6 months to a year is what I'm guessing, but I'm going for a second opinion. I'm 37, and while everybody has cataracts, usually you're old and gray when you have to have that surgery. And when I found this out, I was devastated. Devastated beyond belief. They say that steroid use is a common factor of why you would maybe need cataract surgery earlier in life than later. I really wasn't on prolonged steroids. I used them intermittently, a few days here and there, very rarely. What I really think is that it's my antidepressants that I took for a really long time. Again, as a migraine preventative drug. Of course, there's no evidence of that, but there was no research done. And I've always been really in tune with my body, and it's just a correlation that's easy to make. I was on a high dosage, and it just makes the most sense to me. Another thing is that I took birth control pills for a really long time. Initially, when I first was dealing with my migraine illness, we thought that it was hormonal. It seemed to be hormonal. So I was on a birth control that suppressed my menstrual cycle. It's only a few times a year so that I would hopefully get relief. It didn't ultimately work, but it was one of those pieces of the puzzle. My puzzle had a lot of pieces. Now that I'm off of them, there are a lot of side effects to that. My hormones are always all over the place as my poor body tries to readjust. Bodies have an incredible way of healing itself, and I try to really give my permission and understanding to let it do what it has to do. And sometimes it takes longer than I think that it should, or the doctors think that it should. But it was really badly beaten up, and I need to allow it to do whatever it has to do. I'm grateful that there's a surgery that can fix my eyes, and that it's not a devastating thing in the grand scheme of things. It was devastating to learn that because I didn't even know that was a possibility. But, you gotta take it as it comes. On the show Chasing the Cure, this poor girl had cancer at 14 and beaten it. And now, as a 20-something-year-old, had terrible, terrible teeth, almost no teeth. And no one would touch her because of all the complications she had, but the radiation and the chemo had destroyed her mouth. Through the show, some wonderful team of doctors, dentists, donated their time and money. That's the other thing, right? You gotta be able to pay for it to help her. And that was really beautiful to see. When you have a chronic illness from a young age, it affects your whole life, of course, but it affects your life going forward too, not just in the past. When I was at the height of my illness, I was in my mid to late 20s. And I always remember even on the days that I felt well enough, like I had an office job and everybody was going out to happy hour, I was working with a lot of really great young people that were my age, and they always wanted you to come. And when you said you couldn't or you wouldn't, meaning well, they would say, no, we're going to miss you. You have to come. You have to come. But for me, I couldn't drink. And while I could, of course, still gone to the bar, the smell of alcohol, drinking alcohol, all of it, maybe getting home later, or just would be a domino effect and trigger me in a very bad way if I was already doing okay. I didn't want to force the issue. And really, it's not fun to be the only sober person in a bar. You want to be able to have a cocktail with your friends and blow off steam and just be regular. And although my disease had a name, nobody really understood it. I didn't really understand it, I guess. And nobody understands that you can't have fun. It sucks the fun out of you even when you're not in pain. Because I can't go out 2 days in a row and still get up for work. I can't function properly. My body is hanging on by a thread. And it just changes everything. Even on my 30th birthday, I think I had a sip of sparkling wine, but it was a sip. I was on Ambien, I was on antidepressants, I was on a lot of things that you couldn't mix it with alcohol. And it's just a hindrance. You feel less than, you feel embarrassed, you feel robbed, you're cheated of a normal experience or whatever experience you want to have with your life, you know? And chasing the cure is only half the problem. It's dealing with all the other after effects. This weekend, I experienced something new. Because of my Botox, I'm numb in my forehead. So really the only thing that really affects me right now is weather anyway, in terms of triggering my migraines. I'm not sleeping, we're not drinking enough water. But I usually feel it in my sinus area. And this past weekend, Friday to Sunday, I had this little bit of tension right up the top here, kind of where my injection sites are. And so I had tension, and it reminded me of a time in my life when I never wanted to do anything. It's this feeling of not being within your body. Maybe because the pain is central, it's in your head, that it always feels like an altered state. Like you're participating wherever you can in a conversation or even something small, and it's taking every fiber of your being energy-wise because you're not really in it. You never feel like you're in your body. And now, it's not like knives are shooting in your head. It wasn't ever that kind of pain for me. It was like a dump truck that was on fire, pressing and burning. And it was the pressure of the pain that made it unbearable to like see, or I could see, but to concentrate enough to like see what was happening and pay attention to what was happening. And it's exhausting. I had a very little bit of that this weekend. And normally, because my pain isn't there when I'm numb, I was confused by it. I was annoyed by it. And I did what was instinctual for me. I went through my laundry list out loud of what could have triggered this. If I've done anything to aggravate my head, or if it's just life. It's something that I've been trained to do, my body's trained me to do over the course of dealing with my illness. So finally by Saturday, I couldn't take it anymore. I was on the couch all day, did nothing. I got up and went to the gym miraculously. By the time I came back and showered, I was annoyed with my head again. I took an anti-inflammatory, which normally works wonders for me nowadays. It did nothing. Sunday came, I was out to lunch, I tried another anti-inflammatory, and now I'm getting pissed. I wasn't totally terrified, but a small piece of me certainly made me sit back and go, what would I have to do if I had to go on daily preventative medication again? What would I do? I would be devastated. And ultimately, I wouldn't rush to that. And I mean, I've talked about this with my neurologist. She and I have a plan. We'd probably try one of the daily preventative injections in between Botox first, but it's not something I want to really think about. But finally, I ultimately took a pain pill. What I call a pain pill. Sorry, triptans. They're migraine pain relief pills. They're not opiates. Opioids never stop a migraine. In fact, they usually induce them. I do not use medical marijuana or edibles, though it's been suggested to me not by doctors, but by people in my life. When I have a lot of pain in my head and a lot of the feelings that come with it, I already feel out of body. I have no desire to feel out of body or high. And it's not actually treating my medical condition. I always want to reiterate, I have a medical condition. And for me, that ain't the answer. I've never tried it, but I have no interest in it. If it works for you, I'm happy. God bless. But it's not for me. Please stop suggesting it. Anyway, my pain pill ultimately worked. It might have worked better or faster had I taken it initially. But I didn't notice that that's what it was, the migraine maybe presenting itself. It was a new way. My body does that all the time. Things that, symptoms that nobody else gets, but I know myself and I can make the correlation. Sometimes it takes longer. All of a sudden I wake up and that symptom or sign I used to have all the time, it's not in that leg anymore, it's now in my hand or whatever it is, and it takes some time to program it. I also don't like taking my pain pill. I used to feel like it was a defeat, like finally I have to take one, and it was just acknowledging that I was that sick. But I don't take them hardly at all now, and so it didn't feel like that this time, but it has kind of a lingering side effect. It feels like my nasal passages are open a lot. My jaw gets really sore. I don't know if it's because it's connected to the nerves that it's helping relax or whatever it is, but it's not a great feeling. And once you've already been in pain for a while and the feelings that come with that, I wasn't in the mood. But I took it, it worked, and I'm back to being me. All of this talk about chasing the cure and finding what works for you is a lifelong battle. And we're all just doing the best that we can. So I just want to say, if you haven't found what works for you yet, if you're still chasing your cure, don't ever give up. Do whatever works for you and live the best life that you can. I will forever be grateful and blessed that Botox is what works for me and that I can live the life that I imagine, even if it's just a little bit at a time. So that's my 2 cents for today. I will talk to you real soon.